In April 2025, the director of the National Institutes of Health described a proposal to develop national disease registries, including a new one for autism. Days later, officials walked back claims that the intention was to develop an autism registry and instead focused on plans to create a real-world data platform that would help researchers get more complete data. This was followed by an announcement that NIH would be partnering with the Centers for Medicare and Medicaid Services to create a data platform aiming to uncover the root causes of autism and other chronic diseases. All of this is the topic of this week's Healthcare Triage. In today's episode, I bring my day job as Academy Health CEO into the show, sharing the latest findings, policy battles, and what it all means for real people. Special thanks to Steph Lomangino, Suzanne Farris, and Elizabeth Cope, from whose Academy Health blog post this episode was adapted. So what is a real-world data platform? It's a system that collects, stores, integrates, and analyzes health-related data from clinical settings. Data sources can include electronic health records, claims and billing records, product and disease registries, and patient-generated data from apps and wearables. Such platforms can be transformative for research by offering comprehensive data sets that reflect patient behaviors, experiences, and outcomes. By harnessing such data, researchers can gain diverse insights into complex dynamics of risk and disease. This opens the door for precision medicine to tailor interventions to individual genetic, environmental, and lifestyle factors. This approach has the potential to improve treatment outcomes, reduce adverse effects of care, and make healthcare more cost-effective. Patient registries are an important data source for real-world data platforms. They provide a way to gather data from larger, more diverse populations than clinical trials, which is crucial for understanding rare diseases or specific patient subgroups. So why does the Autism Initiative give us pause? Carefully designed real-world data platforms can be powerful engines of discovery, but they are not without potential risks, including diminished family and community trust, threats to data privacy, and perpetuating harmful narratives. Taken together, collecting information about historically under-researched groups without strict safeguards in place can jeopardize individual, family, and community safety and impede the ultimate goal of better care and outcomes. Government and healthcare mistrust is often more commonly felt by populations that have historically been excluded or even harmed by interactions with research, including people with disabilities. Disability protections are relatively new, and for many families of children with special healthcare needs, there are clear and personal memories of autistic children being institutionalized, segregated from their peers, and mistreated. There are real and recent cases where people with autism have been inappropriately discriminated against in healthcare, employment, education, housing, and public access to resources. This has all happened in a time when disclosure of a diagnosis is left to the discretion of a family. So the idea of involuntary disclosure and the maintenance of a list of those with an autism diagnosis understandably raises valid concerns. History has shown us that science can be appropriated by ideology and used to inflict harm. For example, the Supreme Court's 1927 decision in Buck v. Bell, which still stands today, upheld involuntary sterilization of people deemed feeble-minded by the state. This decision resulted in the forced sterilization of at least 60,000 people by the 1970s. If we want to avoid harmful policies rooted in bias, discrimination, and the devaluation of certain lives, it is critical to center legacies like this when developing and using real-world data registries. So what does the autism community need to see? Well, at minimum, 3 things must be addressed fully and transparently: shared governance of the platform, data privacy and security, and study design and bias mitigation. For shared governance, the data platform must be designed and governed in partnership with families, accounting for the priorities and concerns of the community. This includes addressing past harms and concerns around surveillance or bias and ensuring that families and autistic individuals have a voice in decisions about what data are collected, how they are interpreted, and how findings are ultimately used. Direct partnership with families could calm concerns by ensuring the real-world data platform's purpose is supportive and destigmatizing. Proper controls are in place to prevent use of the platform as a means of surveillance. robust ethical oversight is enforced, and the platform is compliant with the HIPAA privacy rule, and legal protections are implemented to prevent discrimination or adverse consequences such as employer access to information or use by insurers to deny coverage. For data privacy and security, combining data from different sources must be performed in a way that assures security and confidentiality. The NIH has emphasized the use of de-identified data, and there are ways to do this, but they would have to deviate from the way they currently link to CMS data. And if they plan to do that, they need to be clear about how it will be done, how risks will be mitigated, and how consent will be obtained and privacy protected. And last but not least, design and bias must also be addressed. By their very nature, these data are not collected for the purpose of research, and they are susceptible to confounding variables, selection bias, and information bias. This should be addressed by transparently describing the minimum requirements for study designs, measurements, and statistical methodologies, as well as the specific process for peer review. We have made positive progress in the realm of treatment and support for people with autism. But still, the idea of labeling a child with autism deters many families from seeking services, especially those who've experienced harm. Moreover, even with diagnoses, families face barriers to accessing services. Adding concerns about a registry may only lead to more barriers to care. We have the opportunity to leverage research and data to improve health for all, and there are ways to do this work well. A primary ingredient of successful initiatives has been the deep engagement of patients, families, and communities affected by the conditions under study. We must embody the ethos of nothing about us without us. Academy Health is all about making research matter, turning evidence into real-world impact on health and healthcare. That's exactly what Healthcare Triage is about too. Breaking down the complex, sometimes messy health policy and research stories that affect all of us. And that's why we've teamed up to bring you important episodes like this one. And did you enjoy this episode? You might enjoy this previous episode on aspartame and autism. We'd really like it if you would like this video and subscribe to the channel down below, and maybe go on over to patreon.com/healthcaretriage where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Edward Lilliholm and Joshua Crow, and of course, our Surgeon Admiral, Sam.